Writing the book, clearly, you were not or are not afraid of being labeled. You have incorporated where you were into who you are now, and you're self-accepting so that you're not afraid when you say, yes, I am an addict or a recovering addict or an alcoholic or a recovering alcoholic. You don't feel shame about that.
No, I don't feel shame about being in recovery. I feel very proud of it. I have just crossed the 18-year mark.
Congratulations.
Thank you. And I feel that it allows me to be of greater service and to help vastly more than I could had I not gone through that. And I believe that what we go through, we go through in order to be able to help other people.
I agree with that. If you have a helping type of personality,
Yes.
That's right. It does require that. It seems to me, it's obvious that you would be better working with substance abusers than I would be. I don't have that same history. So one of the things that I know is that relapse is common, and I know that for those of us who have not been abusers, we can be fooled by the folks who are coming to see us, and you're not. Tell us a little bit more about that.
Well, dishonesty is part of the disease, and people are ready to stop when they're ready, and no one else can make them ready. Somebody might come and see me and they might lie. I may or may not know it because some people are very good liars. But what I've found is that if they trust me and they feel safe with me as their doctor, when they're ready, they'll be able to open up to me if they feel that I won't judge them. And I feel personally and professionally that is very, very important, just to foster the environment of safety and trust and non-judgmentalism.
Yes, the acceptance. We talked earlier also about what we therapists learn about working with patients who come with significant anxiety or depression or family issues or a history of abuse, but are also substance abusing. And how do you handle that when somebody comes to you who is substance abusing but also has all of these other issues?
The first order of business is always to address the substance abuse, because until that is done, it's very difficult to even have a clear picture of what the other issues are. There are a lot of people who suffer from depression, yet they're drinking. Alcohol is a depressant, and that's like pouring gasoline on a fire. And for many of them, when they stop drinking, the depression clears up. Not for everyone. And others, secondary diagnoses are masked by the substance abuse, and they emerge later. But once the substance abuse is addressed, then usually within the first 6 months or so, you do have a clear picture of what's actually going on with a person and can then address other things.
Do you say to people, we can only work together if you are going to stop substance abusing?
No.
You keep them with you and you say, hopefully that through the trust with you, they will decide to stop using.
Yes, because they will not benefit as much from therapy, but it's still better to have help than not have help.
And do you find that therapy lasts for a very long time or a fairly short period of time with people who have already decided to stop drinking and drugging? Do the patients want to continue therapy for a long time? Do they see it as too much of a crutch? Is there a pattern in how long people want to stay in therapy after they've recovered?
Well, generally, people, once they have recovered, are now becoming aware of what their real issues are, and that's when therapy can really become useful. Most of my patients stay with me for at least several years. Some shorter, some longer, but I would say on the average, it's several years, depending on where they started and where they want to go and the kind of work they're doing. But after stopping, that's when the real work can begin. And therapy and recovery groups are very complementary. They do very different things. They serve different functions. And a good recovery program includes both.
Tell me the different functions then. You did talk about the group as being supportive and helping with shame.
And isolation.
And with isolation, and people are aware that others are suffering with the same kinds of problems that they are, and that other people are a source of support and comfort. What would you say happens in your therapy?
Well, therapy is different in that it's less frequent, usually on an average once a week, whereas recovery groups are very often every day. So the self-regulation, the coming out of isolation, treating the shame, all of that happens in the groups. But in therapy, there is an opportunity to delve more deeply into specific areas and do different kinds of psychological work with a trained clinician, which is different than a lay person who may be in the group. The group work is based around, certain principles that guide the programs, but the therapeutic work has a completely different focus because of the training of the clinician.
My sense is that that learning how to work with substance abuse is not a part of most psychologists' training.